Good morning and welcome. We will begin our day with a land acknowledgement. Loss and Health Research Institute and our partners are situated on the traditional territories of the Anishinaabe, Haudenosaunee, Lenape, Wendat, and Attawandaron peoples, who have long-standing relationships to the land and region of southwestern Ontario and the City of London. The local First Nations community in this area include Chippewas of the Thames First Nation, Oneida Nation of the Thames, and Munsee Delaware Nation. In the region, there are 11 First Nation communities and a growing Indigenous urban population. We acknowledge both the historical and ongoing injustices faced by Indigenous peoples in Canada and commit to actively listening to, learning from, and building relationships with our Indigenous allies. We value the significant historical and contemporary contributions of local and regional First Nations and all of the original peoples of Turtle Island, North America.
Welcome. So happy to have you here for the Parkwood Institute Research Day with today's theme on Better Together, the Power of Partnerships. And we have a really exciting day for you. I'm Cheryl Forchuk. I am the Burrell and Richard Ivey Research Chair in Aging, Mental Health, Rehabilitation, and Recovery. And let me just share a few slides with you to give you a sense of what's going to happen today, as well as some of the accomplishments that we've had in the past year. So this is just an overview of the day. As you are on the Whova platform, you will see these things in the agenda, and you just click on the various topics throughout the day, and it will easily take you there. So you'll see we've got a number of welcome things. You'll have an explanation of the network and gamification. There are prizes. We have a lot of exciting posters, a bit of a break for lunch, 4 fantastic breakout sessions to choose from. And one of the really great things of the Whova platform is for all of you who have registered, like you can only go to one breakout session live today, but anytime in the next 3 months, you can go back to this platform and see the other 3. If you're in a situation, gee, there's really 2 I'm interested in, pick the one you want to see live today, but you have the opportunity to go back and see the tapes. And it's the same with the posters. If you don't get to everything today, you can still go back. The only difference is it won't be live. At the end of the day, we will have a panel discussion from some key stakeholders, different perspectives on their takeaway from the day. And I did mention again, we do have prizes at the end of the day. I want to really thank our Research Day Committee for 2022, and you see the names of the people here who have done such a great job with the committee and planning today's events. And as well, really want to highlight that the Parkwood Institute Research Advisory Committee, who've been so busy all year, and in particular thanking our co-chair, Kathy Gauthier, who also did the Indigenous welcome today and the land acknowledgement. So thank you all for all the work that you do all year. And there's a number of other committees I'll get to momentarily. So just a reminder of what the Parkwood Institute research is all about. We have many goals, and it's all driven by our vision about measurably enhancing the lives by leading discovery, evaluation, and implementation of innovation and rehab and recovery. And I hope that you're really going to see a lot of examples of that as you go through the various poster sessions and the activities of the day. With the missions, there's a number of key points here. You can see there's more detail, but we really want to conduct research that makes a meaningful difference in the lives of those we serve at Parkwood Institute. We want to empower people who are touched by a student beyond and developing and evaluating innovative solutions that improve health. We want to integrate mind, body, and spirits. And you can see this idea of strong partnerships and collaboration is a key part of our mission. And that part of our mission is what we're really focusing on today. And again, you could see the goals around like best practices for today and tomorrow, et cetera. But really, the overall one is to be a leader in research related to care, rehabilitation, and recovery of complex and chronic illnesses. And although I'm the research chair, there's no way that I could accomplish all these activities without such strong commitment by so many people at Parkwood. I already introduced our advisory committee, but these are all the many subcommittees that we have in place to work on the various activity. Today is just one example in terms of the PIR Research Day with that committee I already shared, but each of these circles represent people from within the Institute, as well as some of our key partners working together to make Parkwood Institute research able to implement those plans and to truly make a difference in those we serve. Within Parkwood Institute research, we have 3 theme areas around mental health, mobility and activity, and cognitive vitality and brain health. When you even look at how today is organized, you'll see how these themes are threaded through, and on the agenda and the posters, a lot of it is organized according to these theme areas. So what have we done this year? And the numbers I'm talking about here are just from the year 2021. We actually have 250 active research studies at PIR. That's incredible to have that many active research studies in our setting in just 1 year. We have over 60 affiliated scientists and researchers. And just in 2021 alone, when we're talking about new funding, it's over $20 million. When you look at very few of these would be 1-year studies. So that does not represent all the research activity, because we have the research funding from 2020 and 2019 also that is still going on. And already in 2022, we've received good news. So just in that 1 year, 2021, over $20 million of activity. So you can see that our researchers have been doing an absolute fantastic job in actually enacting the vision that we're talking about. This year, as in other years, we also support students. It's so important to support and develop the next generation. And the St. Joseph's Foundation has been very helpful in securing various fellowships and studentships. Some of these are strategic initiatives that we directly pay for through PIR, but you can see 3 fellowships, which would be people, say, with post-PhDs, and 4 studentships, which are generally master's students, and 4 travel awards. Our trainees can get to conferences where they are presenting. And even virtual conferences have costs. Again, as last year, we talked about COVID challenges, and that we've really turned some of these challenges into learning opportunities. As you can see, I mean, despite being in COVID, we managed to secure over $20 million in new funding. And so that means we've got a lot of new projects. But some of that have been specifically based around responding to COVID and field work, adapting to the needs of the community. We've had staff working in hybrid models with combinations of in-house and at home while necessary. And I know everybody's tired of the word pivot, but believe me, we've had to pivot very fast, very frequently, back and forth. Our labs have all continued activity. We've got participants and volunteers giving enthusiastic contributions to these trials, and our students continue to provide valuable input. So despite the challenges we faced these last couple of years, it is not, we've continued to work hard and be productive. This is just highlights from last year's event. We're already today at today's event, but just to give you a sense of what we accomplished last year, and we will have similar success today. We have had the last few years an annual open house to bring the community into Parkwood to learn what we're doing. This is an event that's open for the public. We will be planning a similar event this year. It'll probably be around the same time, the end of November. So keep your eyes open. What we've had to do, though, is again, have this as a virtual event. But we got 170 people registering for the event. we were able to get people from across Canada and also a few from other countries able to join only physically at the hospital. That wasn't possible. We had 12 labs, we had live sessions, different videos, and a shout out to the McDonald Franklin OSI Research Center, which was voted the fan favorite lab. So watch for the next version shortly. We also hosted a specific conference. This was with 3 groups collaborating: the Parkwood Institute Mental Health Group, the Lawson Mental Health Group, and the Department of Psychiatry. Over 200 attendees, and you can see the topic. The picture of the dog there was the award winner for best photo. You'll notice today as well, we have some best photo contests. So this is something you've got to aspire to do at least as good as. We also have had a number of virtual education workshops. These are examples of some of the workshops that we have had over the last year. And this has been, again, attended by over 200 people. These are our scientists, our research staff that have ongoing education opportunities. And again, we have pivoted to have these virtually. A special shout out to welcome Siobhan Chabrun, who is the inaugural research chair for the William and Lynn Gray Endowed Research Chair in Mobility and Activity. When you look at the various theme areas, Siobhan also gives us a welcome, but this was a huge, exciting development this past year. This just gives you a sense of some of our scientific success by the numbers. And again, we're only talking about 2021 here. Just last year, over 200 journal publications, peer-reviewed journal publications, 5 books from our scientists, 52 book chapters, over 200 presentations and invited lectures, and 54 media appearances and interviews. So again, the Parkwood Institute research really has been doing very well. So today we're going to do well again because we have this fantastic day focusing on partnership. Thank you for joining us, and we really encourage you to learn as much as possible about the research here at Parkwood Institute Research. Reach out to individual scientists, to individual presenters, and have fun. We've tried to design the day with a lot of fun, with contests, with conversations, networking, and prizes. So learn and have fun today. Thank you.
Good morning and welcome to the Parkwood Institute Research 2022 Research Day on how we're better together, the power of partnership. I'm Dr. Arlene MacDougall, and I'm a psychiatrist and researcher and the Parkwood Institute Research Mental Health Theme Lead. On behalf of the mental health theme, welcome you to this exciting day where you'll be able to hear about some of the great research and innovative projects taking place under mental health. You'll hear about some great work being done to apply cognitive behavioral therapy for a variety of different populations, including the use of internet-based CBT for military and veterans, for people who've experienced spinal cord injury, stroke, and those that care for them. You'll also hear about some of the innovative research to better understand homelessness, as well as how to prevent discharge to homelessness for people who are experiencing severe mental illness. You'll also learn about some of the innovative social innovations that have been developed as part of the Mind Social Innovation Lab, working to promote mental health and well-being in young adults and youth. You'll also hear about some of the long-term outcomes of mood and anxiety treatment program focused on emerging adults. As well, you'll hear about some work being done in spirituality, including the use of spiritual care in the forensic mental health care system, as well as spirituality in youth who have been diagnosed with bipolar disorder. There's lots more as well. Our theme has been very busy over the past year. Despite COVID, our researchers and their teams have continued to get grants, conduct excellent research, and translate that research into practice and policy and other forms of knowledge. We've also, as a research committee, launched our first annual mini Catalyst grants to build capacity in frontline staff at St. Joseph's Healthcare London to do mental health care research. We've also worked alongside others at Parkwood Institute Research on helping to develop and establish a research advisory committee for people with lived experience of mental illness and their caregivers, so that they can better inform and influence the research that we do. And there's many other things, including hosting our most successful in terms of attendees joint mental health research and innovation day in October of last year, which was very exciting. And we plan to do a similar virtual conference this fall. So I hope that you're excited as I am to hear about all the great research being done. And I hope that you enjoy yourself. Please don't hesitate to connect with myself or others in the mental health theme. We want to hear from you, as we all believe that we are better together and there's great power through partnerships. So take care and enjoy.
Good morning and welcome everybody to the PIR Research Day for 2022. My name is Siobhan Chabron and I'm the William and Lynn Gray Research Chair for Mobility and Activity as part of the Gray Centre for Mobility and Activity. My job today is to welcome you to the Research Day and just to very briefly introduce you to the Gray Centre. The Gray Centre forms part of the theme of mobility and activity, and we undertake a wide variety of research from improving rehabilitation in neurological and musculoskeletal populations to understanding pathophysiological and neuroscience mechanisms that underpin disease progression and outcome, to exercise interventions and using behavioural change to inform how we adapt and devise rehabilitation strategies, particularly in a virtual environment, given the current COVID situation. We include people from a range of backgrounds, medical backgrounds, allied health backgrounds, basic science backgrounds, statistical and modelling backgrounds. And we use a variety of approaches from strong clinical research, such as randomised controlled trials, to more basic science research of mechanisms, through to systematic reviews and scoping reviews. As you enjoy your day today, I hope that you'll keep in mind that innovative solutions to some of the biggest healthcare challenges of our time come from the intersection between themes and professions. So as you're listening to talks today and perhaps taking the opportunity to talk with your colleagues, think about how research in mobility and activity might interface with research that is done in cognitive and vitality themes and in themes of mental health. When we work together and we collaborate together, we come up with some truly innovative solutions. Enjoy your day. I look forward to following along, and here's to a really great 22 for research.
Greetings, I'm Michael Borry, theme leader for the Cognitive Vitality and Brain Health theme, and these are our investigators. Be mentioning their highlights over the last year. Dr. Bangu is doing a study on orthostatic hypotension with Dr. Fitzgibbon Collins, looking at low blood flow and cognitive impairment during activities of daily living. He's also the site lead for 2 industry-sponsored studies in people who are at risk of developing cognitive impairment. These are long-term studies using intravenous antibody as a treatment. I am the platform lead for the Compass ND study and will be concluding enrollment in this national study towards the end of the summer. I'm also site investigator for a number of industry-sponsored studies. Dr. Elizabeth Finger is the principal investigator for a study of neurodevelopmental consequences of FTD genetic mutation in at-risk youth and is the co-investigator for the GenFi study in Canada. As well, she's leading the FOXY trial, a phase 2 multi-center clinical trial of oxytocin for empathy deficits and apathy in frontotemporal dementia, and they're enrolling now for stage 2 of the study. She's also the lead for the Brain and Biobank in London. Dr. Montero and his lab have most recently secured funding through the Western Foundation for the Synergic 2 study. He's also the training and capacity building platform lead for CCNA and is very involved with the Brain Health Support Program for the Can Thumbs Up study, which is starting now. Dr. Sarah Morrow is doing a double-blind, placebo-controlled trial of mixed amphetamine salts for cognitive impairment in people with mild cognitive impairment, and has publications listed there. Dr. Pasternak is finishing up the Ambroxol study for people with Parkinson's disease dementia. This is a cough syrup which has been repurposed, and he recently presented these results showing that Ambroxol is raising the level of the enzyme associated with lowering alpha-synuclein. And this is an important finding in people with Parkinson's dementia. He's also the site investigator for these two controlled trials, industry-sponsored, for people with mild to moderate Alzheimer's disease. Dr. Teasel continues his work in stroke rehabilitation, evidence-based reviews with continuous funding for over 20 years. He's also pursuing neurotrauma rehabilitation, synthesis of interventions for moderate to severe acquired brain injuries, as well as spinal cord injury review, examining the evidence, and these are funded both by the Ministry of Health and Long-Term Care. Dr. Jenny Wells is site investigator for two industry-sponsored trials in people with mild to moderate Alzheimer's disease. And that concludes the highlights from our theme. Thank you.
So good morning. It's a pleasure to look forward to another Parkwood Institute Research Day. Now, recently, the Government of Canada released an updated list of its science and technology strategic objectives and the areas of focus. And one of the 5 objectives is healthy Canadians. These guidelines will steer the federal government's investments into research and health innovation for the next 5 years at least. And 11 areas of focus are listed under healthy Canadians. And I'll cite 5 of these: aging population and the impact of chronic diseases and dementia, brain health and retention of cognition, Indigenous health, mental health and wellness, and problematic substance abuse. Then under a second heading objective of innovative and resilient communities, one of the foci is healthy communities and the social dimensions of aging. So there's never been a better match between the research and translational strengths of Parkwood Institute and the priority needs articulated by the federal government. So our challenge is, how do we leverage this alignment to boost the resources we need to find solutions to some of the most pressing problems for people living in Canada today? It's both a huge opportunity and a challenge, but one that Parkwood research community can rise to, I think. So today starts to set the scene for that. And I'm really looking forward to learning how we are making a difference. Thank you.
On behalf of St. Joseph's Healthcare, I'd like to welcome the scientists, staff, care partners, students, volunteers, and all of our community partners coming together today to share how we can truly be better together through partnerships. Personally, I have been on my own journey of awareness and learning about partnerships for change and understanding my place of power and privilege as a white settler in a position of formal leadership. Learning how to be a strong ally doesn't mean abandoning my position, but rather learning how can I leverage my positional power to pave the way, provide support, or lift up voices of equity-deserving populations who I have the fortune of working with. How can I use my voice to share truths and make a better future for all community members? So I encourage you today, as you hear from some of the incredible speakers and participate in the close to 50 different poster sessions, to reflect on your own capacity and commitment to changing what partnership really means, and how can you be part of leading that change from where you stand. What is the one thing you can do differently tomorrow that you will learn from today? Have a great conference, everyone.